My name is Beth Darling. I am a psychiatrist with District Medical Group in Valleywise. I have been with District Medical Group as an attending psychiatrist since July of 2017, right after I graduated from my adult psychiatry residency at Valleywise as well. So I've been here altogether since 2013.
Wow. Okay. And what made you want to go into psychiatry?
That is a great question. I've always been interested in psychology and psychiatry. My undergraduate degree was in psychology, and I always thought I would go on to get a PhD in clinical psych. I did lots of research in my undergrad, and that was sort of the trajectory of my career. And I had a wonderful mentor along the way who said, "Don't do that." And she had a PhD in clinical psych. And it wasn't that she didn't think that was the right field, but I think she clearly knew something about me that I didn't know yet, and encouraged me to go work. So I went and worked for the serious mental illness system in Arizona as a case manager and then as a supervisor for about 4 years while I worked on prerequisites and getting prepared to go to medical school. I quickly learned when I started that sort of social work role in the outpatient setting that I really wanted to be a doctor and wanted to go to medical school, and always had the plan of going back into psychiatry and serving that same community, just in a different role than I was there. And then, so I did that for about 4 years, went to medical school, and I loved a lot of different fields. I'm somebody who can sort of jump in and get excited about whatever I'm doing and whatever opportunity I have. So, I loved emergency medicine. I loved OB-GYN. I loved family medicine. I loved it all. But everything, it was the people interactions and the human component and the conversations that kept bringing me back to psychiatry. And so I did end up sticking with psychiatry and doing my residency here at Valleywise and have enjoyed it ever since.
Yeah, that's wonderful. So can you tell us a little bit more about the ACT program and what it is at Valleywise?
Sure. So ACT, or Assertive Community Treatment, has been around for many years. This is the first program Valleywise has had, and it started up in 2016.
Okay.
Basically, it's a very high intense level of treatment. It's a full psychosocial model, so it's not just me, it's me plus a whole group of people really working to intervene with some very high risk individuals with serious mental illness.
Okay.
Trying to help keep people out of the hospitals, out of the prison system, and integrated within the community and achieving the goals that they want to achieve despite having a mental illness.
And these individuals, are they living independently or?
Most of them. That's the goal of ACT, is to be able to support people living independently in the community. We do from time to time have folks that are not able to live independently, and so they will live in some supported housing types of settings. But the goal of ACT, and the large majority of our patients do live either independently or with their families who can support them in the community as well. And then our high intensity level of services provides a lot of in-home type of care to help whatever needs that person has. We're very individualized in how we meet the needs of that person. I think what makes ACT really different from the way that services to the seriously mentally ill in this country have been given out in the past is that we try to meet all of our members' needs within our team. So on my team, I have 2 full-time nurses, 2 full-time RNs, a medical assistant, a program assistant, our director of our program, and then 8, instead of case managers, we call them specialists who have varying different specialties. So we have substance abuse specialists, we have housing specialists, we have independent living skills specialists, peer support specialists, and they can provide those services to the patients. We're not having to broker out services the way you typically do in a case management type of setting. And so if somebody comes to me and is like, hey, Dr. Darling, just so you know, I've been using all these drugs I never told you about, I can hook them up with our substance abuse specialist that day, and they can get started on that service immediately. So there's no downtime in waiting for things. Or if people need help budgeting or grocery shopping or with their benefits or different entitlement programs, we are able to help them right then and there.
Yeah. So there's really, they're familiar with your team. They trust, the resources and the people that you're connecting them with. Wow, that's pretty incredible.
The way that this is set up, people get to see appreciable differences in their lives, and I think it helps motivate them to continue to make additional changes.
Wow. Is there any stories or maybe examples that you can share? I know patient confidentiality is certainly something, but anything that sticks in your mind along the way that you could share with us about the great work that you're doing?
I have so many. So that's
wonderful.
Amazing. I know.
Yes.
So it's hard to pick and choose because as you asked that question, there's so many people that run through my mind. And
that's lovely.
I know. It's amazing. I feel very blessed that this is my job because I get to watch people get well and sort of be a part of their journey for that. So I'll give you a couple that are just off the top of my head, and everybody's level of success on our team is so different, which I think is really neat too. It shows that everybody's treatment is so individualized to what their goals are. But we have one lady who has a history of schizoaffective disorder, who's been struggling with that most of her adult life since her early 20s. We got her in her late 40s.
Okay.
She came to us after she was wandering around the country on various buses and getting involved with the criminal justice system and forced hospitalizations in multiple states. And she eventually made her way here to Arizona, where she was homeless, but had a brother here, luckily, who took her stable. After about, I want to say less than a year, we were able to get her independently housed in an apartment that she loves. Now she helps us lead groups. She is an active advocate in the mental health community. She's a phenomenal artist and has been making money selling her art and is really involved. There's a very large mental health art community in Arizona, and she's extremely involved in that, and she's a huge advocate for patient rights, and it's so fun to watch all the different community things she's become involved in. And
that's lovely to not only be able to support her, but then because you're supporting her, she's able to feel confident in supporting others. That's lovely.
Yeah, it's talking with her, it just like lights up your whole day. You can feel it. And
gives me goosebumps just thinking about it. That's
me
lovely.
Too.
Yeah.
She's been kind enough to record herself for us and her story for us. So we've been able to use it for a few. I've presented on ACT at a few different conferences and things, and she's allowed me to share her story. And it's really beautiful. And you can always see, when you're giving a lecture, people are sort of bored and zone out, although I think I'm very interesting. I'm sure
you are very, very
so listen to me. So it's nice when people can hear it right from the horse's mouth, how ACT has really played a vital role in their life getting back on track.
Wow. And for something, for someone to start in such a severe setting, but really be able to, with the help and support of you guys, just, channel that into art and helping her community. That's an awesome story. Thank you.
Of course. Yeah. We're very proud of her. She's been really amazing.
That's lovely. Okay. Did you say you had another one you wanted to share?
Sure.
Okay.
So We also got another lady. She's also in her 40s, and she also has schizoaffective disorder, and she has spent most of her adult life very psychotic, homeless, wandering the streets, panhandling for money, actively using drugs, in and out of hospitals, in and out of jail. Uh, when we first got her, we were routinely having to hospitalize her to get her stabilized. And she would refuse housing. She had been homeless for so long that was her life, and she wouldn't do it. And after getting to trust us and build our relationship with her, we were able to finally get her housed. And she has now been in an apartment and out of the hospital for over a year.
Oh, wow.
She still uses drugs, but so much less often. And she has a safe place to go home to when she uses, instead of ending up in a hospital or in the street somewhere, or in any kind of vulnerable place that she would have been in the past. So, she is certainly not symptom free. She is not, she was almost to the point where she was going to be able to work. We had almost gotten her a job, and that did not pan out because of her ongoing substance use. But man, just to get to see her stay in an apartment, stay safe, and have all of her meals met, and have all of her hygiene needs met, and know that at night she has a safe place to put her head down.
That's huge.
Tremendous. It really has. And we when somebody's on court order, we have to look at that court order every year and decide, does this person need a new court order? And that came up with her just a couple of months ago, and we were looking at it, and we were like, do you know she has not been in the hospital in an entire year? And I don't think that probably happened to her for the entire last decade.
Yeah.
So that is amazing.
Yeah. And I think truly speaks to your team of meeting someone where they are. As you said, at least now she has a safe home to go home to, and just, knows where her next meal is going to be. And that in of itself is just, pretty impactful and pretty amazing. Just to make sure that, that these people are so well taken care of in a place that means, what it means for them and for you guys. I think that's
really neat to see her apartment. She's actually decorated now, and she's really made it a home. It's
taking pride in it. Yeah.
Absolutely. Where when we first met her, it was her and her backpack. That was it, everywhere she'd go. And now she has her place. And she's actually been helping her community too, which is funny. We have a few other of our members that live in her apartment complex, and one of them ran out of food a couple of months ago, so she came in, and she didn't know that I know this person, and was telling me about how she was feeding him hot dogs and making sure he was well taken care of and had everything he needed. And I was like, that is so sweet. I'm just picturing the two of them sitting up there eating hot dogs, enjoying each other's company. And I just, that's really nice.
Creating community within that and support. Yeah, that's lovely. Well, can you tell me, why Valleywise? Why did you choose to work there? And what's so unique about working at Valleywise and the ACT program at Valleywise?
Absolutely. This is a really easy question. I interviewed all over. I knew when I was graduating from residency that I wanted to do outpatient serious mental illness work, and that I really loved the ACT model, and that was really where I wanted to be. And I interviewed at all of the different agencies that have this, and Valleywise is so true to their mission in a way that nobody else is. They really embody that, and you feel it in every clinic, in the hospital, everywhere you go. People are here because that's what they want to do. They are here to serve their community, and you just don't feel that other places. You don't experience it other places. There might be a lot of talk about it, but people don't put that into action. And here, I have never had anybody say no to me on a reasonable request. When I said I wanted to do, we are one of the only clinics in the state of Arizona that does a very special kind of long-acting injectable medication that's very complicated to get approved in the clinic and complicated to administer. And when I said I want to do this, everybody said, all right, well, if you figure out how, go ahead.
Yeah.
And we did, and it's been life-changing for people. And I feel like the barriers that exist other places just don't exist here.
Yeah. I too see that from my end, in employees like you that just, you know, pour their heart and soul into what they do, and also just in the can-do attitude. You know, this is the best thing for patients. Let's make it happen and let's make it work. So thank you so much.
Yeah, I've never heard anybody say anything to me. If it's the right thing to do for your patient, then you do it and we'll find a way. And
yeah,
I just think that's amazing.
That's wonderful. Anything, you know, kind of final comments that you want to share?
Nothing. I am just so proud to be a part of Valleywise and so honored that they've let me stay here for so long. And I hope that they do for much longer. You know, I think things have been really challenging, obviously, with this pandemic. And even through that, I'm so proud to be a part of Valleywise and our efforts there as well. You know, I think that patient and staff safety has always been a priority, and it has shown throughout this current time as well. And I'm so thankful that this is where I work, and I could scream that from the rooftops every day. I'm just really happy to be a part of this community.
Well, thank you so much. I know just bringing up that foundation, it's, you know, I've worked here for about a year and a half at this point, and COVID has really been, you know, a huge peak in my career, in being able to say that I support you know, you guys, I support their employees, and in such a huge time where it's needed. You know, my biggest selling point, of course, as a fundraiser is what we do and how we do it. And I would just have to say thank you to you guys for all that you do, because it's so, you know, I feel like I'm making lives change just sharing what you guys do. So thank you. And thank you for putting so much of your heart and soul into Valleywise and the people that you serve. We really appreciate it.
Of course. Yeah, I wouldn't be anywhere else.